Afternoon, and thank you for joining us for our discussion on surgical subspecialty residency programs. My name is Alden Landry, and I'm the Assistant Dean for Diversity, Inclusion, and Community Partnership at Harvard Medical School. And I'm also a practicing emergency medicine physician at Beth Israel Deaconess Medical Center. I'm going to be moderating this session today, and we're joined by some wonderful program directors who are going to talk about their residency programs and help us to get some insight into the upcoming residency application season. Just to give you a little bit of background about the Office for Diversity, Inclusion, and Community Partnership, this webinar is being sponsored by the DICP. The mission of the DICP is to advance diversity and inclusion in health, biomedical, behavioral, and STEM fields in ways that build individual and institutional capacity to achieve excellence, foster innovation, and ensure equity in health locally, nationally, and globally. DICP efforts support the career development of junior faculty, trainees, and students, identify and train leaders in academic medicine and health policy, and provide programs that address crucial pipeline needs. A little bit about today's webinar. Today's program is the 9th and last webinar of the 2021 Visiting Clerkship Program webinar series. For the past 30 years, the VCP has been a model for excellence, offering outstanding medical students, particularly those from groups underrepresented in medicine, an opportunity to participate in externships at HMS and its affiliate hospitals. Since its inception, over 1,500 students have rotated through the VCP. Obviously, our program has been drastically impacted by COVID-19, and we recognize there's a lot of uncertainty when it comes to the application cycle for residents, for students applying to residency programs. So with this in mind, we are hosting these webinars to bring members of HMS residency programs with medical students together to share ideas, provide support, and address questions on transitioning to the next stage in medical training. These webinars provide an opportunity to discuss the application process, address questions from students regarding away rotations, as well as other concerns that students may have. Just a couple pieces of housekeeping information as we go forward. The chat is not available, but if you do have questions, feel free to use the Q&A to post questions to the panelists. Microphones will be muted, and the webinar is being recorded and will be posted on the DICP website within the next week. I want to go ahead and briefly introduce our panelists for the day, and they're going to share some information about their residency programs. First is Dr. Stacy Gray. She is the director of Head and Neck Surgery Residency Program at Massachusetts Eye and Ear. Next is Dr. Lydia Helliwell. She is the Associate Director of the Harvard Plastic Surgery Combined Residency Program at Brigham and Women's Hospital. Next is Dr. Martina Stippler. She's the Director of the BIDMC Neurosurgical Residency Program. Next is Dr. George Helaban. He is the Director of the Brigham and Women's Urology Residency Program at Brigham and Women's Hospital. And last is Dr. Brian Naheed. He is the Director of the MGH Neurosurgery Residency Program, and he is an Associate Professor of Neurosurgery at MGH. Next slide. And so first, I will turn it over to Dr. Gray to introduce her program.
Thank you so much, and thank you for having me. This is always a really fun event, and I wish that we were all in person, but certainly it's great to reach a large audience virtually. So as you mentioned, I'm the director of the residency program for the combined otolaryngology training program, which involves training at Mass Eye and Ear and Mass General Brigham. And just briefly about our program, otolaryngology is a 5-year training program. We have an internship which involves 6 months of otolaryngology and 6 months of other specialties, followed by 4 years of dedicated otolaryngology training. Most people after completing otolaryngology residency often complete a fellowship in a subspecialty area, and my area of expertise is rhinology and endoscopic skull-base surgery. That's what I practice at Mass Eye and Ear. Our residency program has 5 residents every year, and we have 1 resident each year that, in addition to doing the 5 years of clinical training, also does a 2-year research rotation after their PGY 2-year of training. The things that are unique about our program, one is that research spot, which is sponsored by a T32 NIH training grant. And the other is that Mass Ioneer is the only surviving freestanding Ioneer dedicated specialty hospital in the United States, which makes for a combination of very interesting training given the fact that it's a subspecialty hospital. And with that, I'll turn it over to the next person. Again, thank you so much for having me.
Thank you. And next is Brigham and Women's program in urology.
Hi, I'm George Halevly, and I'm the program director at the Brigham and Women's program in urology. We are a 5-year program. We're centered at Brigham and Women's Hospital with trainees rotating at the VA hospital, the Brigham and Women's Faulkner Hospital, and Boston Children's Hospital as well. We take 3 trainees a year. It's a 5-year program with 6 months of general surgery and the remaining time dedicated to urology training. Typically, after training, about half of our trainees will go to fellowship. The other half go into private practice. We have trainees all across the country. And our application season is a little different than many of the other residency programs in that we have an early match. And so interview season typically starts in October, and rank lists are submitted in early January, and the match is completed by February. So I'll turn it over to whoever is next.
Thank you. And next, we're going to hear from the Harvard plastic surgery residency program.
Hi, everyone. My name is Lydia Hellewell. I'm the Associate Program Director for the Harvard Plastic Surgery Combined Residency Program, which is combined between the hospitals you can see here: Brigham, Mass General, Boston Children's, and Shriners. We are a combined program, not just between hospitals, but in that we take both integrated residents, which are residents that come straight out of med school and who complete 6 years of training, and then we take 3 residents a year through that path, and then we take 2 residents into the final 3 years who have completed general surgery residency. So we have 5 residents per year total. Those residents, the general surgery residents, only do 3 extra years. Our program is pretty varied, and I think that's what makes us unique, that we're at 3 like leading hospitals, including Shriners. And you get to see kind of the full gamut. We have a large number of faculty, and our residency program is actually one of the biggest in the country. And I think that's about it. I'll turn it over to whoever's next.
Thank you. Next is going to be Dr. Naheed, but I don't believe he was able to join us just yet. And so we'll go to Dr. Stippler, who can give us just a brief overview of the BIDMC neurosurgery residency program.
Yes, it's my pleasure to be here and represent the BIDMC neurosurgery program. We are a smaller program. We have 1 resident a year, and we are also a newer program. And this year we will have matched our full complement, so we are around for 7 years. What makes our program really unique is that we are about 2 sites. We have BMC, Boston Medical Center, and BIDMC, which is part of the Harvard system. So you get access to kind of 2 different patient populations. BMC is the safety net hospitals, so you learn a lot about diversity, inclusion. They can care about patients on this side of the spectrum of needs and challenges, but then you also have more a kind of a private practice, more selective practice at BI. And I think that really covers your whole gamut and spectrum of patients you will see. We're extremely busy. They have a lot of uncovered cases. So there's a high surgical volume that we offer. So it's a younger program, which is attracts a unique set of residents and applicants. But we are glad to be here and be represented.
Awesome, thank you. And I know we have a very busy group of panelists, so I just want to jump right into questions. I completely respect and your time for being here. And just for the audience who's watching, we do have some potential needs to leave to go to different cases. So if you see a little bit of a change of the flow, just understand that we're working with some pretty busy surgeons who are joining us for today. But I want to go to my first question to you, Stacy. Just as a general opener, as we think about this process, can you give us a little bit of an overview about the ERAS application this season? And can you talk a little bit about how this application season may be a little bit different than years prior?
So this year, the sort of the time frame for applicants to start uploading all of their information to the ERAS application site, and that again is only for programs that go through ERAS, as some of the other programs like urology, for instance, it's through SF Match, and so that is a totally separate system. But through ERAS, students can start uploading their information on September 1st. And the time that programs can actually download the information is September 29th. So I think the biggest thing for students to know is during that time frame, giving yourself obviously enough time to make sure it's all uploaded and you can certify it and make sure it's correct. So the sooner you're able to start uploading the information, the better, just so you can ensure that everything is accurate. The Dean's Letter, or MSPE, usually is uploaded at the very end of September. And so most programs really start downloading the information once that is actually available. So I think one of the things is that sometimes students will upload information later after that September 29th deadline. And the problem is most programs already have all of their information downloaded. So you just want to make sure that you have everything completely uploaded and certified before then. Last year, the deadlines were kind of pushed back a little bit, but now we're sort of back to normal. And I think we're all much more comfortable handling things virtually than we were last year. And so I don't anticipate that there will be any dramatic differences in the actual application process compared to years previous.
And I think you really hit on a high point that everything's available September 29th. And so programs are anxiously awaiting to review those applications, and they're going to download everything and really jump into during their assessment of candidates as to who they may be interviewing. So it's really important for students to have all of that information available, those letters of recommendation in, encouraging their letter writers to have everything in, because those dean's letters also come in at the same day. So thank you for that update. George, I want to go to you. Given the uncertainty with this application season, do you have any recommendations for students as they're about to really engage in this process?
So I think I can't reiterate more what Stacy said about having everything in on time and by the date that we can download application information. That's really critical to have all of your information in by that download date. In terms of applications and registrations, obviously you want to register for the match. For urology specifically, it's a separate match that needs to be registered for. And we've had in the past folks that have kind of gone through ERAS but have not registered for the urology match and consequently had a negative outcome. In terms of finding out about programs and deciding where to apply, I think the best opportunity is among your colleagues and among classmates that were ahead of you to get a sense of some of the programs. I think later on we're going to talk about getting information about programs. I would reach out to faculty, I would reach out to any of your mentors, and really kind of have a realistic goal of where you want to go and what you want to accomplish in the future. And so we find this whole process is very costly for all of the medical students and future trainees. And I think some of that it is out of anxiety for not getting into a program that they may want to. But I think in general, the match statistics are relatively good, and that it really would pay huge dividends to really strongly consider what type of place you're looking for and what type of training you're looking for when you're applying, and not to overextend yourself.
Thank you for that. I think students are fortunate about the cost component of it all because of the virtual interviews, but we're going to get to that later on. But really, I think the driving home point is get your materials in early. And thank you for the advice about talking about which finding out more programs. I think we're going to dive into that a little bit more in the next couple of questions. Lydia, I want to turn to you because right now students are thinking about away rotations. Some students are doing away rotations, but it's a relatively narrow window. Specifically here for HMS, we had a short window for opportunities for students to come and do away rotations. How will they be viewed as part of the application this season? Is it really important for students to have those experiences, and should they be trying to shoehorn in a rotation at the last minute?
I think, traditionally, I think away rotations for all surgical subspecialties were pretty important because it was a chance for both the programs to get to know the students and for the students obviously to get to know the programs. Last year, we had very few, if any, away rotations. So we kind of, at least our program got a little more used to evaluating applicants without that information. And I think we were really happy with our applicants despite not having had them rotate with us. So I think this year will probably be similar. I think nationally they recommended only one away rotation per student anyways. So there may be students that aren't able to do any or only have one or have one at a program they're not that interested in because that's the only one they could get, etc. So it is a relatively narrow window. I do think if you have a particular program that you feel really strongly about that is your number one, then if you can do a away rotation there, great. It'll hopefully help, though it can always hurt potentially. But I think if you can't, the sub-I rotations that you do at your home institution can be a good substitute. And as long as you do well on that, the letters that will succeed or that you'll get from that will probably equally put you in a good position. But yeah, I think we as programs have adjusted and students are adjusting as well to this new lifestyle.
Yeah, and it'll be interesting to see what these even looks like going forward because I know that some programs have expressed a lot of satisfaction with the trainees that they brought on last year without having to do away rotations. But I think there is something to be said about the value of these experiences. Brian, hopefully you're with us. If I saw that you were able to sign on. We're having this conversation, but I want to give you an opportunity to speak a little bit about your residency program before I jump in and ask you your first question. If not, maybe I'll just pivot and just go back to you, Stacy. We're talking about away rotations. But if a student isn't able to secure a away rotation, will they be looked differently compared to those who were able to secure away rotations?
No, I certainly don't think that will be held against any students, especially this year. A lot of institutions have limited the number of sub-Is that they can actually have. So the number of students that we actually have with us is it's not as many as in years past. And so we're certainly aware of the fact that many students are not able to complete away rotations, and that is definitely not a negative.
So Martina, just a little bit more about this, because part of the importance of doing away rotations is that students have a way to sort of learn about the institution. They're sort of seeing the institution from the inside out. But students may not be able to do so, or there's just so many opportunities for away rotations, but they're unable to do them. If a student has a particular interest in the program, how should they let that program know that, hey, this is a place that I'm thinking about would be a good place for me to come and train?
Yeah, where I think that you pointed it out already, right? The best way of doing and expressing your interest is to go and try to get a away rotation there. If that doesn't work, different ways to find out about the program and express your interest. I think you can go to the website, get the email address of the program director. I think emailing once the match started is a little bit more problematic, but I think before it, when we review application, having and make it personalized. Program directors get a lot of emails, but if there's anything that sticks out and recognizes you in a special way, I think that goes a long way just to get the flags up when we see the application coming across. Also, if you have a mentor who knows, neurosurgery is such a small community, we are like 1 degree of separation, everybody knows everyone. So if your mentor maybe knows a faculty there, they can maybe do an introduction. I think that's a good way. I know our program does a virtual open house. And I think I know a lot of other programs do them as well. So that is also seek out these opportunities. Most of the time they are on Twitter or they are on a web page. So, and then you get a kind of a questions a feel about the people. And don't underestimate social media. You cannot know people from social media if they have the same interests already. So having a presence there, I think, is important as well.
Yeah, it's amazing how savvy these students have gotten with their social media presence. So that's definitely a good point. I see a lot of interactions between programs, whether it's Instagram or their Twitter accounts, engaging with students. And the open houses have been really helpful. I know that students have learned a lot about programs through these virtual engagements because these away rotations aren't available. George, I want to go to you because I think there's a continuation. It's not just the program directors that are out there that could be potential points of contact. Is there value in reaching out to current residents in a program to learn more about that program? Or what about some of the other faculty that may be there?
Here we go. Yeah, I think there's tremendous value in reaching out to faculty and also reaching out to current residents at the program. If there's any connection that you have, like Martina had said, whether a mentor can make an introduction or you can just email as a cold call. It's very helpful because you really need to find a place that's going to be a good fit for you, and there's no way to know about that without speaking to people there. And with the limitations of the sub-I experience, this is a good way to do it. Many programs have had virtual sub-Is or didactic sessions and open houses. And so if that's some of them are for credit in urology, some of them are not for credit. But there's no harm in registering for those just to get a sense of the culture of the program or what the philosophy is on education. Those are certainly reasonable ways to learn about it. The open houses have been very good, but I think the resident perspective is an important perspective for students to get. And that's one of the things that we missed from the interview sessions that were in person, was the ability for people to kind of get a better understanding of what the program is like. So I would encourage folks to email faculty or at least start with the program director or somebody that you may be introduced to, or any of the residents to get a sense about the program. I think the other aspect of it, which is interesting for ENT, and we're doing a pilot program in urology, is this preference signaling project or pilot where for the match, students are given 5 tokens that they can send to programs that they want to express extra interest in. And I think it was designed as a way to sort of level the playing field because of the inability of folks to come and actually spend time at the program. We've never done it before, and maybe Stacy has some feedback on how it worked for the ENT match, but we're very excited about it, and I hope that it's something that works out for us.
Yeah, and not to go too off script here, but Stacy, I would love to hear your thoughts about this, because I know that both general surgery, or not just both, but general surgery, internal medicine, and dermatology are doing a supplemental application where there is this opportunity for signaling. So, while we're talking about it, and thanks, George, for bringing this up, do you want to offer some insights into that, Stacy?
Sure. So we implemented this last year, and the way that we did it, because honestly, at the time that we suggested it, ARAS and NRMP were not particularly interested in partnering with us. And so we used sort of our program director's organization as a way to actually do this. So it's separate from the actual ARS application. You have to submit your signals to the program director's organization. And at least the preliminary data from last year was that this was actually very helpful, especially for the applicants. Really thought that it was helpful for them. It's still, I think, because it was so new last year, I think some programs used it more than other programs. And so I think this year it will be really telling, again, whether or not the programs become more comfortable using it. And so for us, the signals happen before the actual interviews are granted. That's the way that it's used. So it's not after interviews are granted. So I think the biggest thing that was a little bit hard, because we kind of implemented it very quickly, was applicants were not really sure how the information was being used, and they were worried that it was going to be counted against them if they didn't signal a program. But I think the biggest thing from the program's perspective is it's definitely not viewed that way. So it's helpful for us, especially if when a program is reviewing an application, they wouldn't otherwise know that you have a very specific interest in the program. And I think the most important thing with using this, especially because it's new, is making sure that you talk to your mentor about how to use those signals. And whoever is the typical advisor for medical students, whether it's the program director or medical student clerkship director, they will have all of the inside information for this and help you to decide how to use those 5 signals wisely. And so that's the only sort of advice I would give about using it, is make sure you know how to use them well. You're not supposed to use it for your home program, for instance, or if you've done an away rotation with an institution, you're not supposed to use it there, because doing the rotation there already signals your interest. So you just want to make sure you have guidance.
I think it's really helpful for you to hear that. And the one thing I want to reiterate is, as we are making these changes and doing these efforts, which may seem cumbersome to students and may seem as if, oh, there's an additional game or that you have to play. The reality is a lot of these interventions that are being put in place are to benefit the applicants. The goal is to make sure that the applicants are in the best position to match, to help applicants to really pare down the number of programs that they apply to, because we saw a ballooning of the number of places students were applying to last year because of all the uncertainty. And so really the goal is to make sure that applicants are going to places that they're truly interested in and having opportunities, so that other students who are across the country also have opportunities as well. So really trying to share the wealth, and especially when there's limited opportunities when it comes to interviews. So just keep that in mind. It's not an additional burden that the programs are trying to place on the students, but it's really a way to help students really be concise about where they want to go, and help the programs to figure out who are the people that are truly vested in those residency programs. Getting back to where we were, to our scheduled questions, I want to go to you, Lydia, and maybe we're going to combine 2 questions since Brian isn't here. I guess the first part is, how can students overcome a weaker performance in a core clerkship, or maybe not the strongest step 1 score, as they're putting together their application now? And does that involve doing step 2 early? And should students be really trying to shoehorn in step 2 before that September 29th date?
This is becoming a trickier question to answer, as step 1 goes from a number to pass fail. I would say a poor performance on step 1 certainly could be overcome with a really strong performance on step 2. And I think if you think you're going to do better on step 2, that would be, and you did poorly on step 1, that would be a very reasonable thing to do, to take it early and do well on it. There's obviously other things that we value as part of a strong application that are not step scores, such as research, really strong away rotations, good letters, good activities, things you're passionate about, etc. So I think a step 1 score that is weak, I mean, in like a year, it won't matter anyways, but at the moment can pretty easily be overcome. I think because at least in our program, we've started to operate almost on the idea that it's going pass fail, and we need to start choosing our residents with different parameters, because that's not going to be part of the equation very soon. Now, that being said, I think there is going to be a tendency for step 2 to just replace step 1 a little bit. So when step 1 becomes pass fails, people will look for step 2 to see a score that is hopefully high. And I think that'll be the pressure that results from step 1 going pass fail, but I don't know until that happens exactly how it's going to pan out. A weak clerkship evaluation, I think is almost trickier than a weak step score in a way. It depends why it was weak and what happened. It also might depend on what core clerkship we're talking about. So for example, we're all surgeons. So if your surgery core clerkship evaluation is really weak, that's potentially a bigger problem than something core that is not surgery related. That being said, we usually look at all of them because we're hopefully getting medical students who are sort of doing well across the board. But if you do have a weak core clerkship evaluation, I think you should really work hard to do well in your other core clerkships and potentially have an explanation for why that happened. I mean, it depends how weak it is and why it's weak, but it may be worth addressing, perhaps not in the application itself, but if it came up in an interview or something like that, having thought through why that happened and how you might explain it, I suppose.
Yeah, thank you for that. I think it's really important that students, and I think this is partly where you were leading to. I don't want to put words in your mouth, but when you have a weak clerkship experience, students automatically want to address that by doing an away rotation or whatever it may be, but that isn't always the case. And so some students debate about whether or not to put that in their personal statement. I've also heard people asking their letter writers to maybe comment on this as part of their letter of recommendation and maybe explain what may have happened for that rotation. Any thoughts about sort of personal statements to comment on a weaker rotation or letters of recommendation?
I think those are both reasonable ideas. I think probably the letter of recommendation is a slightly better one for some. I mean, I haven't really thought that through, but I think there's lots of reasons one could have a weak core clerkship, and if there is a reasonable explanation, I think talking to your letter writers as a way that they can help you out is a very good one. If you can weave it into a personal statement in a way that makes sense, I think that could be reasonable, but I honestly think a letter would be a better place, but I think those are great ideas.
And I see that Dr. Naheed was able to join us. Thank you. Brian, just because you're jumping in, can you just, one of the things that we allowed all the programs to do is just to give a quick overview of their program. And I would love to just offer you that same opportunity as you're joining us. You're on mute, Brian.
There you go. Sorry, I was a little delayed. I'm Brian Naheed. I'm the program director for the Mass General Neurosurgery Residency Program. We take 3 a year. It's obviously a 7-year program. I'm on with one of my colleagues, Martina Stipler as well. And I'm happy to be part of this panel.
Thanks for joining us. We'll get to you with some questions because I know that I did have a couple questions planned for you. So we'll be sure to loop you into the conversation. But I want to go back to you, Stacy. Thinking about the personal statement a little bit more, any recommendations on how to craft a strong personal statement that really speaks to the applicant? And as a tag along to that question, we've all been universally impacted by COVID. And I know that there are students that want to comment about COVID in their personal statement. Should that be a part of the conversation? Should that be what they're writing about as they write their letter of recommendation? Their personal statement.
So I think sort of big, one of my themes I think consistently is going to be accessing mentors when you are composing your application. And I think that also really is important for the personal statement. What you choose as far as the subject matter should be something that you're able to write about comfortably It should certainly reflect sort of your reason for wanting to apply to the specialty that you've chosen. And that's different for everyone. So the sort of the path that you choose to get there is often not necessarily reflected in the rest of your application. And that's usually what students choose to write about. It is not, and it is typically, at least for most surgical subspecialties, based on participating in panels like this, it is often not a time to be really an outlier, I would say, just because sometimes that can be read the wrong way. So I would say that you want to keep in mind the audience that you are applying to. But once you have sort of drafted a personal statement, I really think that accessing the residents first to review it can be very helpful. So I think everyone, if they're able to have sort of what I would describe as a resident mentor in the application process, because they've gone through it very recently, is very helpful. You don't want to give your personal statement with grammatical or flow errors to your faculty mentor. And so that's why I think often having more than one set of eyes to review it before you actually let them review it. But I do think most faculty mentors are very comfortable sort of reviewing the personal statement as well. And they can give you a broader view of sort of looking at what the typical application looks like and what the typical personal statement looks like, meaning not just from your own home institution, but also sort of across the country. And I think that's sort of the last step that you want to go through. And that way you'll feel also more comfortable in knowing that you're sort of you're hitting the marks. As far as COVID is concerned, I think you're right. I think we're probably going to see a lot of personal statements that have something to do with COVID. I don't think it's a wrong thing to include that, especially because it's probably the biggest event that all of us have been impacted with. But again, I think you want to be pretty focused as far as what you're trying to convey with that message.
Thank you. And I think you and I are kindred spirits when it comes to mentorship, because I think it's really important that people think about this with the help of a mentor or mentors, whether it's which programs to apply to, how to use these tokens for the specialties that are doing it, the letters of recommendation and personal statements, and even how to do mock interviews and prepare for those. And we're going to talk about that coming up as well. So I think it's really important to have a mentor or two who you can lean on through this process. It makes the process go a lot better and helps you really with those anxious times that you may have during the application season. Martina, a little bit more about letters of recommendation. As students are hopefully already asked for their letters of recommendation, but let's say there's a student who hasn't, what should students be looking for in a letter writer, and what can they do to help that person who they've identified to write the strongest letter of recommendation for them?
Yeah, so letter of recommendation, especially now with virtual interviews, less away rotations, are so important because they give us a little glimpse in your personality, how you work with others. So they're so very important. And so whom you should seek out? So if that person doesn't know you and you have to think about who is that person again, that maybe not be the right person to write your letter. And I get so many requests of letter of recommendations where I don't really remember that person. So that is important. You need to have a strong relationship with a person. This person should know you. If you, that could be in your home institution, if you go on a away rotation, maybe give a heads up. I will ask you for a letter of recommendation. So the writer knows to look for specific examples and kind of remember things to write about you. Look for a very diverse group of people to write your letter. In medical education literature, there has been so much written how, especially in minorities, race, gender, how bias can creep into letter writer. Right. So I would argue find a very diverse faculty to write your letter, not just this most senior mentors you might have, because some newer faculty that may be more in tune in writing a non-biased letter of recommendation. And then if for some reason this is not like your main mentor that knows you very well, but you had an away rotation or some interaction, write him a letter or say an email, I would like a letter of recommendations. And here, like 4 highlights, like I did this meningioma with you and it was so great. So they're, oh yeah, that's the resident, that's the medical student. And then they can work with that, give them something to work with so they don't have to read through your CV in too much detail. Give them a couple of bullet points. And like, I really loved how you worked with me in clinic and it was so revealing when we saw that patient back. Give them some memories you have about their interaction with them, and then they can really write a very authentic letter for you.
Thank you for that insight. Programs really value letters of recommendation, so I think it's really important for you to think about very consciously who you want to be those individuals writing those letters of support for you. Great advice. It doesn't have to be the most senior person. It doesn't have to be the person with the least amount of hair or the gray hair who is writing your letter, but it may be that individual who does know you quite well and can write that strong letter of recommendation. So think about having a spectrum of individuals who can write those letters for you. Lydia, we talked a little bit about this, but I just want to touch back with you talking about the supplemental or secondary application. Is this something that you're going to be seeing from your specialty as well? And just any other thoughts about the supplemental application if you have it?
Well, I can speak to plastic surgery. We are actually not, the thing that's happening in plastic surgery is that they have started a plastic surgery specific application that is separate from ERAS. And the idea is that it will be free. So to reduce some of the cost burden, and it's essentially ERAS, but sort of like trimmed down and more focused on things that we think as a specialty we will care about more. Unfortunately, because we're in the transition process from that, almost every program in the country, except for I think 7, are accepting both. Whereas there are certain programs that are only accepting this new application. And I think there's only one program that's accepting only ERAS. So this year is unfortunately a little bit confusing. Last year was also confusing, but I think the goal is hopefully in a year's time, we'll switch to just the supplemental application for plastic surgery. It's a little bit tricky because if you're applying in general surgery or another specialty as a backup, you'll still have to do ERAS. So you may have to fill out an extra application, but it'll hopefully cost you less. I don't know exactly what other specialties are doing, but I don't think we're gonna have, I don't see supplemental applications coming down the line, at least in our specialty, because the push has been to make things easier and cheaper for students rather than adding more, but we'll see.
Well, that's good to know. I didn't even know about this new change with the plastic surgery application. So thank you for sharing that. And hopefully our audience is aware of that and planning accordingly, again, with the support of their mentors. Brian, I want to bring you into the conversation. OB is committed to virtual interviews this application season. I'm hearing word that other specialties are moving in that direction. What do you think will happen with your surgical subspecialty when it comes to virtual OA rotation? Virtual interviews this year?
Yeah, I suspect we will be going to virtual interviews as well across the nation in neurosurgery. There might be opportunities for folks to visit programs or certainly spend some time. Certainly the sub-I's provided that, and there probably will be something later as the numbers change and move, but I've been telling all of our students to prepare for it to be a virtual only. And if it reverts back, then that would be awesome, but chances are to be virtual.
So prepare accordingly. And speaking of which, Stacey, how can students shine during a virtual interview as opposed to an in-person interview?
So I think one of the things that has been really great is that a lot of schools have really provided help and guidance as far as this is concerned, because they want their students to typically shine. So I think that some of the really basic things are thinking about sort of where you're going to be, where you're going to be located, that you're in a place where there's not external noise, that you're able to really focus, that there won't be distractions. And a lot of schools are providing actual spaces at the school as well. And so I think asking early about resources is very helpful. The other thing is just making sure that your technology is totally up to date and that there are not going to be any issues with that. But the truth is that programs realize that Alden, you and I were talking about this earlier, that there are likely to be hiccups. And I know last year we had like 3 backup plans. So we had all of the students' cell phones so we could FaceTime with them if we happen to lose a Zoom connection. And I actually think that you want to think about that from the program standpoint. So I think one of the things is that applicants have a lot of anxiety during this process, but the truth is programs really want you to be able to meet with us. We want to talk to you. We're not trying to make it difficult. We actually want to provide the best experience for you. And so you want to see how accommodating the programs are. And if they're also thinking about this and worried about this and making sure that if something happens that they'll have a way to contact you, that's a good sign about the program, that they're actually, they want to make the experience a positive one for you as well. And short of that, I think the only other thing is eye contact, so which is really tough when you're doing it on Zoom, but that's why practicing is really helpful. And again, most schools have practice sessions, and certainly those are things you can access the residents for as well, because most of the residents in your specialty will have just gone through this process, especially the interns who actually went through the virtual process last year. Asking them for some tips, I think, can be really helpful as well. And you can ask them a lot of questions that you might not feel comfortable asking your faculty mentor about.
Yeah, I think, just to add to that, if you haven't done a virtual interview, you should at least practice it a few times just to get comfortable with the environment and the technology issues we were talking about that earlier. Stacey, you're right. It's not uncommon for Wi-Fi to go down or you to have a technical glitch. Do your best to keep your system up to date. And if things happen, our programs are going to try and roll with it, and hopefully you'll try and roll with it as well. But we certainly expect these technology glitches to happen. So George, I want to turn to you because we've talked about everything from, the thinking about programs, contacting programs, applying to programs, interviewing programs. But on the back end in February, students are going to be putting together, or January, February, they're going to be putting together their rank list. And so what should students be considering when they're finished with interviews as they're putting together their rank list? How should they start to organize their programs?
It's a good question, and I think it's an important question. One thing that I think students shouldn't shy away from is if they have questions about the programs that they've interviewed at, they should feel free to reach out to those programs to get that information clarified. The programs will not reach out to any applicants once the interview process starts. It's a match violation, but there is ample opportunity for students, if they have questions, to help them make up their mind about the program or where it goes on the list, to be able to ask that question. And typically it goes to the residency coordinator, and she would funnel it to the appropriate person so that it doesn't unduly influence the program director or somebody else. We try to keep it separate. And a lot of people have had just basic things like, where do people live? And kind of logistical questions. Related to the match list and where you want to live, I think there are a couple important things to consider. One, do you have a support system in the area that can help you? Because many of the surgical programs are very arduous, and it's challenging to be on your own. Secondarily, is there something unique about a program that makes it your number one? And what is it about that program? And what other programs are similar to that? And then the most important thing is to not match or not list a program that you would be unhappy at if you were to match there. You can't overemphasize it enough. And I speak to the sub-Is that come through with us that, they may be more comfortable at a program that may not have as much prestige, but they will be so much more successful and productive and learn so much more if they're in a comfortable and supportive environment than if they're in an environment that's going to be very difficult for them to succeed in. And that's something that I think is important for candidates to understand when they're going through the interview process, so that they can really, our interview of medical students that are applying to residency is as much an opportunity for the students to interview us to see if this is really where they want to be. And I think when you're putting together that list, you really have to think about that because it's a long time and there aren't that many opportunities to switch things around after the match.
You know, it's really, I want to double down on one of the first points you said and one towards the end. One of the first points is knowing about the support network and having that support for you during residency. It is tough, regardless of the specialty that you're going into. So being able to have those things that will keep you whole while you're doing this residency program, whether it's family connections, social networks, faith-based support, whatever it may be. I think it's really important for us to think about that because life does exist beyond the hospital. And yes, we have the 80-hour work weeks, but you will spend time outside of a hospital. You need to be happy in the place that you're around, or you need to be able to have those resources that are there to support you, to uplift you when you're having tough times during residency. And then on the back end, and it's great to hear you reinforce that, you know, don't rank places that you don't want to be, because the last thing you want to do is commit to, a 5 to 7 year relationship with a residency program and be miserable that entire time. So don't put those places down on your rank list if you don't want to be there. So great points. Real quickly, just in the interest of time, Martina, and I hate to rush through these last few questions, but I think there's a lot of value here. We're thinking about resident wellness. We were just talking about being in a place where you're happy. What is your program doing to support trainees as we address issues in medicine related to burnout and physician wellness?
Yeah, thank you. I think this question is a beautiful segue in what George just said, right? The hospital is one part of your family, but you need to have your support system outside as well. So what we do specifically, and there are many things, we actually just had a meeting with our residents and see what they wanted to see. So we had kind of a resident-led effort. We didn't just want to shove it down their throats. And we're going to have a wine tasting journal club, which they wanted to do. And we have a wellness day. So they can take, everybody gets a wellness day and they can decide what they want to do with that day and just take it off with no question asked. Of course, it needs to be planned, but it doesn't come out from there. It doesn't come out from their vacation time. So they get a wellness day. And what our hospital has, I'm a nurse neurosurgery, so it's always, do we want to teach wellness? Do we want to teach resilience? Because it is hard, surgical specialties are hard. Not that other specialties are not hard, but there's some unique challenges. We have a great peer support system. So this is where you as a resident, if you had a challenging case interaction that you want to talk through, you will be matched anonymously with another resident at your level, but not necessarily somebody that is in your reporting structure, right? Not a neurosurgical resident, maybe somebody else. And we have this for faculty, we have it for residents. And I think that's a good way just to do a little reality check of what just happened and help you to get through some more challenging times, which there will be in your residency, even if you're most supported.
I'll be looking forward to my invite for the wine tasting journal club. Please send me an invitation.
That's what they chose. We had to open, that was their choice. So
Awesome.
That will be that.
Brian, can you talk about the culture of Boston? There's been a lot in the news about the city of Boston, Massachusetts, New England, about culture and climate and racism. Can you speak specifically to how your UIM trainees have reported their experiences in being here?
Sure. It's a super important question. I think all these questions, starting from George and Martina now to this, all interplay with the idea that so much of choosing the right residency is choosing the right program, choosing the right environment, choosing the right culture, and frankly, choosing the right city. I would say almost all of our residents are transplants from a different city. A lot of our faculty are as well. We are lucky that a lot of our faculty loved it so much that they stayed on. There were residents who stayed on and became faculty, which gives you a little bit a window into at least the culture of the program. I think Boston's a major city. It's a lovely city. It does, like every city, have some of its issues that it's working through, and certainly diversity is one of them. We've been fortunate that at Mass General, There's been not only a concerted effort on diversity and inclusion, but also one where we support each other like any family should and would. We've been really, really fortunate that our group is small, right? We're only 3 residents a year, 21 in over the 7 years. And so when you join our residency, we very much feel like you are joining a family and look out for one another. We've been lucky enough, I trained there. We've been lucky enough not to have major issues, but little things will come up over time. And as many of the panelists have said, it's really the collective good of everyone who's looking out for everyone. And that's regardless of stage. But I think as a med student, it was lost on me, but now looking back as an older person, you actually have a lot of power in your choice. You should choose a program that you connect with not only the residents, but the faculty, but also the culture and the environment of the city. And it's hard this year with virtual interviews to get a feel for what that city is like. But that's what hopefully phone calls and visits where applicable can hopefully help.
Wonderful. And Stacy, just a last quick question. We're representing multiple teaching hospitals. There is a thought that there's a lot of competition between the institutions. Can you share your thoughts on the relationships between the various Harvard teaching hospitals, and what's the relationship like? Is it cordial? Is it competition? What do you think?
So I think one of the things, especially since we're speaking to sort of people who are applying for residency, is that often the residents are the glue that hold together an entire department. And that's because it's a shared responsibility of teaching. So for a lot of the people that are on the call, the residents rotate through different hospitals. And I think we all feel very invested in the training of the residents, and that makes it a very collegial and collaborative sort of feel. For otolaryngology, we're unique in the sense that our academic department is actually across all Harvard hospitals. So we do have a separate training program now at the Beth Israel Deaconess. That's a newer program as well. And there is a separate program there, and yet there's still a lot of collaboration between the programs. And I think that that's probably the case for most of the surgical subspecialties. The other thing is that surgical subspecialties in general are small fields. So we all know each other. So certainly within a city, we all really know each other very well. Many of us train together. And so I think that also generally makes it a very collegial and collaborative environment.
All right. Well, thank you for that. I would like to say that I think we all get along pretty well. And I think it's a testament to you all being here on this webinar, sharing your experiences as program directors. That to show that we do work well together. I want to wrap it up very quickly because I know we have some busy surgeons on with us. And I want to go just rapid fire. Last question for all of the remaining panelists. Any final words of wisdom or advice for students as we close? And I'll go to you, Lydia, first. Any final words of wisdom?
I think some of the best advice is to just talk to a lot of people, talk to residents, talk to people who've applied in whatever specialty you're interested in ahead of you. Talk to your mentors, because the more information you have, the less mysterious and intimidating the process is. It is an intimidating process, but I think with more information in your hand, you'll do great. And it's a matter of sort of finding the best fit for you, also in terms of what specialty you do, but also in the place where you're going to have the most success. So I would just talk to a lot of people, get as much information as you can, and that will hopefully help guide your decision.
I'll go to you next, Brian.
I think this is an amazing moment where you get to learn about programs and not only introduce yourself to the programs, but frankly to the field. And with that comes this ability to also check out and see where will be your best fit, so you can do the best, and really taking that active role. Believe it or not, you have a lot of choice, and all of us are here to help you. And I think Stacy said that it's such a small field that, you know, you might be an applicant today, but you're going to be a resident tomorrow, and you're going to be my colleague the next day. And so I think most of us feel that our closest friends are within our own specialty, and we look forward to seeing more and more applications into it.
I'll go to you next, Martina.
There are so many data points in the end, you will spend more time with these people in your residency than you will with your family. So just go with your gut. Like if you like these people, if you have a good time in the interview or whatever, this virtual world, if you said, these are my people, that's your place to be. You will spend more time with them than with your family for the next 5 to 7 years, whatever. So go with your gut.
And last but not least, Stacy.
So I think first I'm going to reiterate the importance of mentorship. So having people that have your best interest at heart and can help guide you through the process, that's the most important thing. And the second is to realize we all know that this is anxiety provoking. We are fully aware that this is a process that everyone who goes through it is anxious. And we really are trying to actually make sure that you make the right decision. We want to match people into our program that are going to be happy. So we're not necessarily even looking for the best applicant. We want people who are going to be happy to be in that program for the next 5 years. So it really has more to do with the fit of the program. And the more that you try to get at that information and the more you allow the programs to sort of help you with that, the happier you will be for the 5 years of training.
Awesome. All right. Well, I want to say thank you to all of our panelists, to Dr. Gray, to Dr. Aleblian, to Dr. Helliwell, Dr. Nahid, and Dr. Stippler for joining us. Thank you for your insights. We do have some upcoming events that I'd like to share with you, mostly being that our September 11th is going to be the date that we're hosting our Harvard Residency Showcase. It's going to be our 8th year doing this program. Unfortunately, it's going to be virtual, but we look forward to seeing as many participants there as possible. On the left of the screen, you can see where you can follow some of our residency programs and learn more about what they have to offer as we discuss the importance of social media. Feel free to click through this very brief survey that we have for you. And as a reminder, the webinar is being recorded and will be posted online, hopefully within the next week. And good luck to all of the students as they go through this journey on making the transition from medical student to resident. And thank you again to our programs for joining us. I wish everyone a good rest of your day. Take care.